How do antimuscarinics work to relax your bladder? Imagine your bladder as a stretchy balloon that fills up with urine. When it's time to go, your brain sends signals to the bladder muscles to contract and releases urine. But sometimes, these signals become overactive, causing urgent and frequent trips to the bathroom. That's where antimuscarinic medications come into play. They help calm this overactivity by targeting specific receptors in your bladder. Antimuscarinics work mainly by blocking muscarinic receptors, especially the M3 subtype, which are found on the smooth muscle of the bladder called the detrusor muscle. Under normal circumstances, when you need to empty your bladder, a chemical called acetylcholine binds to these receptors. This binding causes calcium to enter the muscle cells, leading to contraction. When the detrusor muscle contracts, you feel the urge to urinate. Antimuscarinic drugs prevent acetylcholine from attaching to these receptors, so calcium doesn't enter the cells, and the muscle doesn't contract as strongly or as often. This results in a relaxed bladder that can hold more urine comfortably and reduces the feeling of urgency. But the effects of antimuscarinics go beyond just relaxing the muscle. These medications also influence the sensory nerves in the bladder lining. The bladder lining, or urothelium, contains receptors that help sense how full the bladder is and send signals to your brain. In cases of overactive bladder, these signals can become exaggerated, making you feel urgent even when your bladder isn't full. By blocking muscarinic receptors in these sensory pathways, antimuscarinics help dampen abnormal nerve signals, which can lessen the sensation of urgency and improve bladder storage. Most antimuscarinic drugs used for overactive bladder are designed to target these receptors selectively. Common medications include oxybutynin, tolterodine, darafenacin, solifenacin, and trospium. They differ slightly in how selectively they block certain muscarinic receptors and in their side effect profiles, but I'll share the core mechanism of preventing acetylcholine from triggering bladder contractions. In cases of bladder conditions like bladder cancer, antimuscarinics may be used to manage symptoms of bladder overactivity or irritability. However, their use should always be guided by a healthcare professional, as they can have side effects such as dry mouth, constipation, or blurred vision, and may interact with other medications. In summary, antimuscarinic medications relax the bladder by blocking the M3 muscarinic receptors on the detrusor muscle, preventing involuntary contractions caused by acetylcholine. They also reduce sensory nerve activity in the bladder lining, helping to lessen urgency and frequency. Always consult your healthcare provider to determine if these medications are appropriate for your specific condition and to discuss potential side effects and treatment options.